Hi, everyone. Today, we're going to continue our discussion on sort of thinking about biopolitics and thinking about how it sort of functions in the context of medicine and public health. And so, really, the argument that I'm trying to basically get everyone to sort of say is that public health, exists, and the sort of protections over medicine exist, right? Because it's a strategy that, these organizations obviously, take, but obviously the US obviously can't, accomplish this, task sort of by itself. And so thinking about the sort of cooperation efforts that obviously these organizations take, and thinking about the sort of globalized network that the United States is, we can obviously see that it's important that the United States projects the idea or the ideology or the sentiment behind that they want to help other countries control and prevent those dangerous diseases, right? Obviously, they want that to happen, but they want it to happen on their own terms, right? And the fact that they want it to happen on their own terms as opposed to sort of wanting it to happen in general because those people are obviously sick, and obviously ensuring the health of every individual should be a top priority. They have obviously registered the assumption that certain bodies should be preserved through a certain type of discourse, right? And we're trying to get at that discourse itself also, while simultaneously saying that it's important to regulate and control those bodies, is also simultaneously naming those bodies as distinct from those who are worthy of being safe. And so thinking about how that distinction produces the green light on a certain set of technologies, and those technologies do not seek to get rid of the ideology that produced the need for the technology in the first place, but instead seeks to extend that type of governance, right? It seeks to extend the way that biopolitics sort of in the name of the community, in the preservation of the self, in the name of the individual, all of those things exist so that the United States public health policy obviously can be premised on the idea of functioning, right, as a sort of core that is not disease, that is not dirty, right, but sees disease as sort of an emerging threat, right? And so thinking about how this sort of phases itself not only at the level of the political but at the level of the social, that's important, right? Because it allows us to understand how sort of space is sort of organized and how development, sort of is relational. And so evaluating, thinking about the right to, I guess, thinking about individuals' right to, clean space, right? All of those things do not matter, right? Yes, people need to people desire clean space, right? But are unwilling to acknowledge the way poor environmental qualities are sort of, designated in the status quo, right? It's like that is the problem. And so thinking about the way the resolution will attempt to produce, sort of technological related, solutions to a sort of, structural problem about certain I guess certain ideological preferences when it comes to preserving the socioeconomic status of certain groups, then we can obviously understand how the logic of the West, the logic of the US extends itself past the intellectual property of the law itself, and instead treats bodies as commodities themselves, right? And so if we think about how the privatization of certain things exists in order to be regulated upon, then it does not matter if those protections are amended, right? That all it matters is that logic is attached to a liberal understanding of how to resist violence, right? And so if you're a critical team and thinking about how ways that you can sort of take the resolution and sort of play with it, you can obviously, you want to first be thinking about, like I said, COVID-19, and thinking about the apartheid and the way that certain bodies are made more at risk to violence as as opposed to the status quo, and that how that intensifies because of the WTO. And in our next video we'll be talking a lot more about the WTO and its liberal sort of mechanism, and thinking a little bit about why the liberal mechanism of public health, and why the WTO itself are ultimately violent apparatuses that attempt to, create opportunities for, more profit, right? We'll talk about structural adjustment programs, right? And thinking more about how those structural adjustment programs work and why they are reinforced, by, certain developmental, practices. And so really, that'll be basically what we talk about in the next video. But really, if you just want to think about racial capitalism, you just want to think about sustainability, right? You want to think about how space is organized, and you really want to think about how, the distinction between how certain bodies should exist and how certain bodies do exist is how certain people are made disproportionately available for the violent results of violent policies, right? And so thinking about how certain populations represent the outcome of certain technologies is how we'll understand how governance reproduces itself through not purely at the political level, but also at the level of the social. Thank you.